Lower back pain is a huge issue that is poorly understood, which is why so many struggle to find lasting relief. However, with the right understanding, you can start taking steps to make real changes, eliminate the back pain, and get that lasting relief you're looking for. If you're new here, welcome. I'm Michael Fatika, the lead osteopath and spine specialist here at Back in Shape, and we help people in the UK and around the world fix their back pain and get back in shape for the long term. And in today's podcast, we're going to be giving you the blueprint to help eliminate your back pain with strategies that are proven to work for thousands of patients and members of the program online. We'll be covering the theory, diagnosis, the causes of back pain, the critical mistakes so many make, and then that 4-part blueprint for lasting relief. And finally, we'll touch briefly on some of the treatments and how they work in you to complement the good work that you're doing at home. So many people with back pain that lasts longer than 6 months really struggle with diagnosis. And there are 2 real forms of diagnosis. And these are our own sort of categorization of them. So please bear that in mind. But we start out with these, what you call pseudo or fake diagnoses. And these are diagnoses which patients hang on to, but they don't really tell you anything. These include things like stenosis. They include things like sciatica. And what these statements are saying, for example, in the case of stenosis, it is just telling you that some of the holes in the spine are smaller than they otherwise should be. There's less space there. It doesn't tell us what's going on. That's in the next part. And the same thing for sciatica. Sciatica is simply a statement like saying you have leg pain or like saying you have arm pain. It doesn't tell you why that pain is there. It doesn't tell you the injury that's actually caused your sciatica. You can't have a sciatic injury. You have to have an injury that causes sciatica. So these sorts of diagnoses are a little bit misleading because they don't give you any useful information. Understandably, people want to get to the bottom of what is causing the injury. And we have to understand that there are a finite number of things that can cause this in the lower back. And real back pain diagnoses would include things like herniated discs. They'd include things like spondylolisthesis. They'd include things like facet injuries or sacroiliac joint injuries. These are injuries to specific tissues in the lower back. And they'll generally be identified through some orthopedic testing that's in a clinic and or through the confirmation of these findings on various imaging such as MRI or X-ray. Ultimately, if we're thinking of a real diagnosis, we might have something like an L4-5 disc bulge right down here that is causing stenosis, i.e. a narrowing of the little hole where the nerve comes out, giving rise to symptoms of sciatica and back pain. That would be a sort of diagnosis. And you see how it covers a number of different areas. And commonly, there are a number of areas that are going to be affected. If you have a disc bulge, for example, it's very likely that the height of this disc has dropped, evidently, because we have the disc bulge there. But the facet joints are more likely to come together, which is why you'll often get commentary of facet joint involvement or degeneration or irritation alongside that. Understanding this is really important because if we try and chase one of those particular symptoms, we're going to end up tying ourselves in knots. And the amount of times people would come into the clinic and they'd say, oh, I got, this guy said it was my disc and then he did something and it didn't work. And this guy said it was my facet joint and then he did something and it didn't work. Or they provided momentary relief. And that's because the whole problem is not being considered in its fullest, if that makes sense. And then this leads us to the next part, and that is the myth around back pain, or the big mistake. And that is that all of those diagnoses that I've mentioned, and we've got many more listed on the article that's associated with this video, link in the description, is that you're going to nearly always have some element of muscle spasm. And the big problem is for more or less all cases of lower back pain, certainly here in the UK, when you first go to your GP or your physio, it's a muscle. Your QL's tight, your glutes aren't firing, your hamstrings are in spasm, so we need to fix those. And that is not the case. The reality is those muscles have a reason for being in spasm. They don't spasm for no reason. And short of you doing a particularly intensive bout of exercise with some serious damage to the actual muscle, they will be in spasm because those segments, let's just say that L4-5 disc herniation we referred to, are irritating the nerves that are giving rise to the spasm in those muscles. And too many struggle and allow themselves to slip into this chronic back pain category, i.e. for longer than 12 weeks, because they are chasing the muscle symptoms under bad guidance fundamentally. We never get a lower back muscle injury as the primary problem. And even in the event that we did do something like an extremely heavy deadlift and we failed and the muscles failed, the discs and the spine itself, those structures we mentioned earlier, the ones that actually become injured, those will be injured in the process of that muscle failing. And your muscles are really, really great. They've got so much blood supply. They're going to heal just fine. And the problem is the thing that doesn't heal just fine, especially if we don't consider it in the injury, are those spinal structures, and they take an awful lot longer to go through that healing process. And if we're just focusing on a muscle problem, or what we think is a muscle problem, we end up neglecting our spine and preventing the appropriate healing of that area of the spine that's really injured and struggling to get better. Ultimately, the real cause of lower back pain, and this would include sciatica too, stems from a failure of the spine to deal with the load of gravity in some manner. And as a result of this, we have injury to the structures of load bearing that will include the disc in the vertebral segments, as most commonly is the case at L4-5 and L5-S1 of the spine. But we're very commonly going to also get other failures, other irritations, other issues that arise with that, especially as the problem goes on longer without effective intervention, treatment, and rehabilitation. Things like thickening of ligamentum flavum, which are some of the deep ligaments in and around the spine because they're under more stress and strain. It could be that there's some facet joint arthropathy or facet joint hypertrophy, which is when the little facet joints on the back start to enlarge because they are being put or having too much pressure put on them on a daily basis. But fundamentally, it all comes down to that failure to effectively deal with load. And we're always going to get that degree of muscle involvement as well. And once we start to understand this, we can dispense with strategies to stretch the tight muscles, which include things like child's pose, include things like hugging your knees, include things like figure 4 stretch where we're rounding our lower back. And we can start to have a more sensible approach to this treatment that prioritizes the underlying injuries and the important principles that need to be adopted around those. So for example, if we have that L4-5 disc bulge, and I'm just using this as an example because it's easier for you guys to see it on the camera, is as we get this disc bulge, because we've bent forwards, the disc bulges backwards and fills this space, and then we have a lot of inflammation around there. So what do? You start to round your back even more to try and make this hole larger to decrease the pressure that's building up there and causing your back pain symptoms or your sciatic symptoms. And in the process of that, these muscles start to get unhappy and you start to feel tension. You also feel a little bit of referral going down the leg perhaps, and glutes and hamstrings tightening up too. So you deal with it primarily as a muscle problem, a tension problem. And so you stretch these even more. You do even more child's pose. You do even more stretching of the hamstrings, trying to round. And every time you're walking along, you squat down and stretch your back off to ease that tension, all the while reinforcing the very injury that caused this. And you see, if we start to take a spine-first approach, we can put this spine back towards the right sort of position. We can support it more effectively. And this is the strategies we're going to go into shortly. And that will allow those muscles to finally relax a little bit more, feel a little more easy, and ultimately resolve both the muscle stiffness, tightness, and symptoms, and help support the healing process taking place in this spine. Ultimately, the simple cause of your back pain could be a primary failure of your lumbar spinal segment at L4-5 or L5-S1, failing to deal with the load of gravity, resulting in injury to the structures of that segment, including the disc, and the facet joints and their surrounding ligaments, with a degree of muscle spasm, stiffness, and tension in the surrounding lower back musculature and or the muscles of the glutes and hamstrings along the distribution of the nerves that come out of that particular segment. So now we understand the causes a little bit better. We can start to take the right steps to deal with the back pain. And this is going to be covering these 4 steps. These are steps that are based on the in-detail advice we give our members in the Back in Shape program and have used in clinic over the years as well. So hopefully you're going to be able to make some notes and really follow these to the letter. We're going to include a little bit of conversation and then a little bit of demonstration as well where appropriate, so you guys can pause the video, follow along and understand exactly what we're talking about. We'll also link to many of the relevant resources to help you get a better understanding of what you need to do at home too. So the very first thing we're going to be doing is learning to control the core. And the core is not just the musculature, it's the spine as well. We're learning to maintain this neutral position of the lumbar spine. And this involves us learning to do a core engagement, which we'll demonstrate in one moment. This core engagement allows us to provide stability where the injury or the instability associated with injury down here in the lumbar spine is giving rise to unnecessary movements. Those tweaks and catches that happen on a daily basis when you're doing silly activities or ordinary activities that shouldn't cause back pain are bothering your lower back because these segments are not supported effectively because they're injured and therefore they're vulnerable. So learning to engage your core is your tool or your ticket to be able to protect that spine on a daily basis. It also makes the exercises later on significantly more effective as you're able to actually protect the spine from being pulled in one direction or another, provoking and irritating those tissues that are trying to heal. The very first exercise we teach all of our members in the Back in Shape program is the core engagement drill or core set engagement drill. And that is learning to correctly engage this deep core set of muscles to provide stability to your lumbar spine. And we'll get into a demo now. So for the core engagement, we can start lying on the bed, but preferably on the floor. In this position, there is a small hollow underneath my lower back because my spine is in neutral. My rib cage is touching the floor and my bum or sacrum is touching the floor. and then my lumbar spine forms a bridge. This is the position we're going to engage the core in. And what we do here is take a nice deep breath in, using the diaphragm, and the tummy rises, like so. And then as we breathe out, we engage the core, the tummy tightens, and we imagine a corset wrapping around our entire trunk section here that is being squeezed in all directions. You then breathe again, breathe in, and breathe out. And really hold the out breath to squeeze. And you'll feel the muscles around here really tighten. Have your hands on your waist. Find your belly button and the bone on the side here, come in the middle, and that's where we're going to place our hands. And as we do it again, we can feel our core engagement. Breathing in, and then out. And we can feel them right here, engaging tightly. This is opposite the lower lumbar spine on the back, L4-5 and L5-S1. One of the vital points with this particular exercise is that we do not do any pelvic tucking, okay? Those of you that are just flattening the spine towards the ground. Those of you that have done Pilates and yoga in the past will often have been instructed to do this. If you struggle to do the engagement that we've done in that previous demonstration, then you can always check out the video, link in the description, on the candle drill, which is a movement hack or a breathing hack to help you feel what it's like to engage that lower section of the abdomen that braces the L4-5 and L5-S1 segments safely. Moving on from the core engagement, the simple truth is you are going to have muscle spasm, right? The hamstrings, the glutes, the lower back muscles, they're going to be tighter and stiffer than they should be. And one of the important things we must do in these cases of lower back pain is provide a degree of mobility to the hips, but it needs to be done correctly, and too many people do it wrong. They involve their lumbar spine in hip stretching. This is not necessary, it's not advisable, and unfortunately, it undermines the healing process as we've discussed earlier on. And that's why we've got a full 10-minute follow-along routine. There'll be a link in the description you can follow along with, doing these stretches safely and effectively. Take note of the lumbar spine not moving during these stretches. That way, we can target the hips, and we will need to do this regularly, a couple of times a day. It only takes 10 minutes, as I discussed, but that will help take pressure off the lower back periodically by mobilizing the hips a little bit so that the hips can partake in more of the movement, so that your lumbar spine gets a little bit of a break. But know that in the early stages of recovery, this has a limited reward for time invested. It is going to be temporary because you're still going to have those signals, but going from the lumbar spine down to those muscles. But as you progress through this four-part process, four-part blueprint, you will find that the effect of the stretching lasts longer and longer as the back heals and as you get stronger. The next thing, still in part one, is us regularly decompressing the spine. And this can be done after you've done that hip mobilization. And what we're doing here is we're using a small rolled up towel, like so, and we're placing it underneath the lumbar spine, underneath these segments. Not down here, right down here. And what this does is provides a little bit of gentle decompression and resetting of the normal alignment of your lumbar spine. We've got a full video that demonstrates a couple of strategies that you can use, including the towel decompression like this and how to do it. There'll be a link in the description, and I would strongly recommend the towel exercise, just as I've mentioned, and the bed decompression in that video. They are great ways of you safely and gently taking pressure off this lumbar spine and off the musculature to help provide that regular decompression effect to those discs, taking pressure off those bulging or damaged discs. Maybe they're degenerative, maybe they've got a full-blown herniation. But you can do these multiple times a day, 2 or 3 times a day, as instructed on that video. Check it out, link in the description. Then we move on to hot and cold therapy. Now, we used to just advocate ice, and icing is going to be great for around about 3 to 5 minutes, but if you have the time and the resources, using contrast bathing can really help. Why is it important? Because much of your symptoms beyond the initial aggravation are going to be a result of inflammation building up in this section of the lower back where we maybe have a degree of stenosis or congestion. And as that inflammation builds up too much, it creates pressure in a finite space, and we then gives rise to our symptoms, or that need to bend to make the space larger and alleviate the pressure. If instead we are using contrast therapy over this region to manage the excess inflammation from building up, then we're going to have much more success. This is a great side effect-free, drug-free way to target inflammation reduction or management to the injury in your lower back. It must be done over the spine, and there's a full step-by-step guide, a link in the description that you can follow to know exactly where to place it and how to do it. But just for instruction right now, we're going to be taking 3 to 5 minutes of heat and then ice, or ice and then heat, always trying to finish on icing directly over the lumbar spine right here, one after another, a couple of times through. And you can repeat this 3 to 5 times a day. You can even repeat it more frequently, but do not do the individual applications for longer. So in review, part 1 is really about creating the environment to regularly take strain off this section of the lumbar spine. It includes the core engagement, learning how to stabilize your spine in the moment and on a daily basis, and should be applied to your daily activities. And we've got the mobilization of the hips to take strain off the lumbar spine so the hips can do a little bit more and reduce the likelihood of the lower back being involved in day-to-day movements or in exercise-based movements. Then we've got the regular decompression, taking pressure off your spine so that it can get a bit of respite and resetting that alignment through things like the towel exercise. And finally, we've got that contrast bathing or icing if you don't have the convenience or the ability to do the heat and hot and cold. And that way we can manage the excess inflammation, which plagues so many with their regular relapses. That inflammation needs to be managed, and doing the contrast therapy or hot cold therapy is a great way to do that. Now we're ready to move on to part number 2. In this next part, we're learning the movements that maintain a healthy spine, and you're already doing many of these every single day, so it's about time you started to learn to do them correctly. And for a full disclaimer, we used to have everyone that would join parts of the program would fill in this form. We've had thousands, if not over 10,000 submissions of this particular form, and almost no one is ever bedbound when they start, which means they're doing daily life activities. You're getting out of bed, getting on and off the toilet, so you're doing all of these different things, going up and down stairs. So you need to start these exercises straight away. It might sound daunting, but you do what you can without aggravating the spine, and you learn with correct technique, which is why I've got a couple of demos for you coming up very shortly. But these activities replicate 3 movements of daily life. Number 1, I've already said it, getting out of bed or getting off the toilet seat. That's a squat. Number 2 is going to be things like washing the dishes, or it could be washing your face or brushing your teeth or preparing a meal, and that is the hip hinge. The ability to bend without the spine bending, so bending from the hips. So many people can't do this. And the final one is the reverse lunge. This is going up the staircase, going up a step when you're out and about walking or walking over something, distributing weight through one leg and then another. Really important skills that we must learn because we're doing them every day, and it's about time we learn to do them safely. So with a simple squat, we want to stand with our feet shoulder width apart, with our toes and our knees pointing in the same direction. We then want to engage our core, stand nice and tall, engaging a chest pop. So all of our back muscles are engaged. Our core set of muscles is nice and engaged. And then we're simply going to initiate the movement with our hips going backwards and drop down into the squat like so. Knees, toes, same direction, drop down, come back up. From the side, again, feet nice and comfortable, shoulder width apart or thereabouts, toes in the same direction as the knees, stood nice and tall, core engaged, back muscles engaged, bum going backwards first, and then we initiate the movement down and back up, down and back up, down and back up. As low as is comfortable, maintaining a neutral spine throughout. Some common mistakes on the squats. As you're going down, your knees roll in. This is generally a sign of the glutes not quite working as well as they should be and allowing those knees to drop in towards the middle, and it's not good for your knee health, but it's often a sign of the glutes not being as strong, and that's going to affect your lower back. The second mistake as we go down is allowing the rounding of your lumbar spine, allowing your bum to tuck under and the lumbar spine being pulled into that flexion position, compressing the lower lumbar discs and stretching the ligaments on the back of the spine. So the hip hinge is another simple one. What we're going to do is stand, feet shoulder width apart, core nice and tight, chest pop, so chest engaged, back muscles nice and tight here. And all we're doing is hinging at the level of the hips without bending the knees this time. So going straight, backwards, and then come back up again, backwards, and come back up again, backwards, and come back up again. From the side, very simple. Everyone's going to go a different depth on these, but knees slightly bent, not locked out, slightly bent, and then simply hinging backwards and back up again, backwards and back up again. Spine staying neutral throughout the entirety of the movement. Common mistakes with the hip hinge is that you're bending your knees, doing kind of like a squat hinge rather than a pure hip hinge. The second mistake is that people lock their legs out completely or lock their knees out completely, hyperextending the knees, and that's just going to put unnecessary stress on the back of your knee joint. And the final error, just like the squats, is that our lower back's not being controlled and you're rounding the lumbar spine. The reverse lunge, very similar training points to the previous exercises. We want our core engaged, we want our back muscle engaged, and our chest popped out so we're nice and strong in the spine. Then we're going to place our feet in front of us a little bit more narrow, and we're simply going to drop back into that lunge position like so. There, and back up. There, back up. There, and back up. From the side, same thing. Nice and strong with the spine. We're going to hinge as we do the movement, and then simply there, and back up. There, and back up. There, and back up. With the reverse lunge, we have some common mistakes again. The most common of which affecting the knee is the knee draws towards the middle. Very similar to what we discussed on the squat. This is a failure to use the glutes to control the stability at the level of the knee, and that's often just a weakness that's there, and that will be corrected over time. The other common mistake is that as we go back into the lunge at the bottom part, we arch our lumbar spine, creating pressure on the lower lumbar region and closing those little holes, potentially pinching some of the nerves down there. And the final mistake is that we don't hold our pelvis level. And as we weight bear on one leg or the other, the pelvis tilts to the one side. Again, closing the holes on the one side of the spine versus the other. And this again is a failure to stabilize the core with that proper core engagement that we discussed in part 1. The most important error that people make that will give rise to aggravation when you're doing these exercises is going to be a lack of control of the spine. And that's why using the tape test, and we've got a full video link in the description on how to do this, is a great way of you starting to connect your brain to your spine and line up what your brain thinks is happening versus what's actually happening a little bit better. I always say it's like having a reversing camera on your car using the tape test to just give you that better awareness with what's actually going on in that lumbar spine. The big thing with the second part is that you have to apply what you're learning in these movements to your daily life. So it's no good that you learn to do a great hip hinge and then anytime you go and brush your teeth, you're rounding your back like a fishing rod. This is where the secret lies. All of those day-to-day aggravations that we discussed earlier on in the video, you weren't doing anything particular. You're just getting the things out of the back of the car. And then the back went, or it might have gone then, who knows? And it's because we're not applying these strict principles of the exercises we've just discussed to our daily movements. So start to do that immediately, and you will find that immediately you remove a significant factor in the perpetuation of your lower back pain, a fundamental block to the recovery. So make sure, please, that you start from day one applying these great movements as you learn to do them effectively to your daily life. It makes a huge difference. Ultimately, healing takes time. And if you can stop aggravating the lower back on a daily basis through application of correct technique, whilst you're going through the strengthening process, which also takes time, you're going to find you allow that healing to gather momentum because you're not aggravating it every single day. The next part of recovery is helping guide that healing process that's taking place in your lower back. And this involves adding resistance to the movements that we've just discussed. Once you've learned how to do them technically correctly, you need to start to provide resistance to the spine so it knows how strong that it needs to be. And this needs to be done carefully. Many of you will be very cautious about doing this. Others of you will have pushed ahead in the past and got your fingers burned, and so you'll be cautious again as a result. So make sure that when you're doing this, you're preserving good technique and steadily applying resistance. One of the reasons that we like using resistance bands for the 3 exercises we just mentioned in part 2 is because the resistance band is most strong when you're nice and tall. And as you lower down through the movement, it gets a little bit weaker or a little bit less challenging as you become a little bit weaker in the lower part of the rep. So resistance bands are a fantastic tool to start to steadily apply a little bit of load to your spine so that it can continue that remodeling process. Remember, healing has 2 parts to it. We've got that first kind of scab formation, that first patching up, and our symptoms tend to go down at that point. Maybe not all completely, but they go down. And if we're making the applications that we learned in phase 2 or part 2 of this video, then we're going to find that we're aggravating less and less. And now we need to safely, with a neutral spine and our core engaged, perform the previous exercises with a degree of resistance to start to strengthen up those tissues. Our body is always on a continuum of strength or relative weakness. The body is constantly looking, does it need to be stronger? Does it need a bit more bone density? Does it need to strengthen up these ligaments and tendons because they're exposed to more load? Does it need to strengthen up the muscles? We see they're very obviously in the muscles, but we don't quite appreciate the same role happening in some of the other tissues that you've injured. The thing is, you don't need complex regimens, fancy exercises, standing on a Swiss ball or doing things on one leg. You need the foundations, the movements that you're already doing every day. And the thing is, as you get better, as you add resistance, you'll build confidence because you'll be able to point to specific exercises that you can do. And you go, I know every day I pick up a 15-kilo band, or I do squats or hip hinges with a 15-kilo band, that shopping bag that's 5 kilos in the back of the car isn't a problem for me anymore. And that's very liberating, but you've got to carry on. Part 4 is building strength in the back for the long term, getting back in shape for good, if you will. And this involves continuing to progress the resistances that you're using. And we've got a couple of strategies for you in a moment to help you do this. But ultimately, life has load. You're going to go on holiday. You're going to pick up the grandkids. You're going to pick up your own children. You're going to do stuff or move a heavy pot in the garden. And life has load. And therefore, we need to make sure that we are building our resistance to that load. Because if you can build up your squat, your hip hinge in particular, to be able to comfortably manage a degree of load, then the daily tasks, carrying a 30-kilo holiday suitcase with a rucksack and a child on your hip, is going to be much, much safer for you. And again, as mentioned a moment ago, it builds confidence. These next couple of strategies really comes down to the tools we're going to be using. And the first one is subbing out the resistance bands for things like dumbbells and kettlebells. And commonly, we can take a grip up here, holding the weight up by our chest, transitioning to holding it lower down between our legs as our grip strength weakens. We can also use things like weighted vests. And we've got a full video on how these can be incorporated and for who. Link in the description, because that's a great tool for some of you to continue to build resistance where your arms aren't quite strong enough to hold it. And there are a certain group of population that really struggle with this, and it can help you do that safely and slowly. And if you get the adjustable weight vest, then you can do this in increments as small as 1 kilo. So you can really steadily expose your spine to a little more load rather than jumping too fast. Final option for many of you will naturally be the barbell in the gym. Using a barbell to add weight slowly over time to build up the strength of your squat and your hip hinge in particularly, to start to expose the spine to more load whilst holding a neutral spine with a strong core. These fundamentally are the core exercises. You might be thinking, where are the dead bugs? Where are the marching bridges? Where are the abdominal rotations or the other exercises? Those are great foundational earlier on. You can add those in. They're great, and they feature in the Back in Shape program in some of the earlier phases. But the thing that's going to really build your back strength, your core strength, is going to be something that challenges the muscles and the spine under load. And nothing is going to be better for that than using things like the barbell with those simple movements. Yes, others are going to help balance and coordination and other factors which are important, but this is going to build real strength. Ultimately, it's a tried and tested way to improve objectively the strength and stability of your spine and lower back as a whole. One final caveat, because you might be thinking, oh, we haven't added any stretching or flexibility or comment on that. And for most people we found over the years, really the importance is a lack of strength, and that needs to be built. It needs to be rebuilt because you can't flexibility your way to a stronger disc. It just doesn't work. However, as we start to build strength, flexibility will become a parameter that improving is going to be helpful. To the degree that we have a more severe objective diagnoses of structural damage in our back, maybe we've had rods put in the back, maybe we've had some fusions, maybe we've got a spondylolisthesis or a more severe disc herniation or degenerative disc disease, it is more important that we have strong and flexible hips. And that's why strategies to improve the flexibility come in this stage, if you will, of the recovery process. Once we've built a good degree of foundational strength, and that's kind of different for everybody, but you need to make sure that you are prioritizing strength over the flexibility. But at a time, there is credibility in improving the flexibility. And that's why we came out very recently with a really cool 5-step video on how to instantly improve your hamstring flexibility. And that's definitely worth checking out if you need a little bit of help at the right time improving your hamstring flexibility, and you can take those principles and apply them to the other muscles of the hip to make improvements there too. The final part of this video is leveraging treatments, leveraging specialist treatment and intervention to help you in this recovery process. And there are really 2 categories we're talking about here. And we're not going to talk about drugs or medications or injections or surgery and that side of things. We're primarily talking about natural remedies or approaches where we can use certain treatments to improve the healing that's taking place in our lower back. And we'll cover these now. The first is going to be the natural therapeutic interventions. These are what I would classify as basic. And then the reason I say that will become obvious in a moment. But essentially, we've got things like osteopathy, we've got chiropractic, we've got physiotherapy or physical therapy if you're outside of the UK, got acupuncture, cupping, massage, etc. And the thing that you need to understand with these, they are helpful, okay? And we've done many of these in the past, and we still do aspects of this today as well. But you have to understand what they are doing. And the important thing that we have to understand here is that they are not intervening at the level of, let's just say, that L5-S1 disc herniation or degenerative disc or whatever it may be. Most of the time, They're going to be working to improve the mobility of the hips through soft tissue techniques or articulation or mobilization techniques. They might be using joint manipulation techniques, as in the case of the osteopath or the chiropractor, to mobilize the thoracic spine so that the areas around the injury can work better, and therefore the injury itself is less likely to be overstrained. They're taking the slack, if you will, pulling together these other areas of the body to make sure they're working as well as possible so that this area that's injured can heal effectively. But fundamentally, all someone else can do to you is free things up. Release stiffnesses in the joints, mobilize the muscles to release them a little bit more so they allow for a little bit more movement. But they can't do the all-important that we've discussed in the previous parts of this video, and that is strengthen things up. It's just not possible. And no one's putting any joints back in place, if that makes sense too. While there might commonly be terms of putting a joint back in place, this is often simply manipulating the joint to release and preserve or restore normal joint mobility, particularly down the spine. That's those clicks and pops that you'll commonly get. The important thing here is that you understand precisely what these treatments are doing for your body and how they fit into the recovery process. They're a great tool, and many of our members, and we have used them with patients over the years. They do help, but we have to understand what it is doing, and it doesn't negate the need for you to do the hard work at home, but most of you will already know this. That's why you're watching this video. Finally, we've got the optimal natural treatments, and these are the ones that we've sought out over the years, we've invested in to try and bring an extra layer to the recovery process and help people that really need it. And this is our chosen ones, being the IDD therapy and the laser therapy. This is class 4 laser. These are therapies where we can safely, directly intervene at the level that's injured. So we can get down in here, we can target to improve the recovery and healing process at the L5S1 segment. We can directly, gently, safely, and in a programmatic way, take pressure off this L5S1 or L45 herniated disc to really get results. If you want to read a little bit more about these particular therapies, then there'll be a link in the description to a recent podcast we did on IUD therapy specifically and how we feed in the laser as well to make that work in complement to or complementing your work at home. Because again, neither of these therapies strengthen your body up. You need to do that at home. Hopefully you found this rather lengthy video helpful. If you've made it this far, then I really hope you did. If you do know someone else who's struggling with their back pain or sciatica, consider sharing this video with them. And remember, there's 2 ways we can help you. Number 1 is through the program, and that's the full online membership to the Back and Shape program, link in the description. And number 2 is you can always visit us here or arrange a virtual consultation at the Back and Shape studio, and we'd be happy to sit down with you one-on-one and help you get to the bottom of your back pain and really work with you to make those results happen. Thanks so much for joining us, and we'll see you in the next episode of the podcast or the next video on the YouTube channel.